Over 60 and feeling tired all the time? Getting cramps in your legs at night? Noticing that your hands and feet are always cold? These might seem like normal parts of getting older. But what if I told you they are not normal at all, and that your body is actually sending you urgent warning signs about your blood circulation? Today, I am going to share the 7 most important warning signs of poor blood flow that every senior over 60 needs to know. Some of these will surprise you, and the last one on our list is the one most seniors overlook completely, but it may be the most important of all. So please stay with me until the very end. Here is something that many people do not fully understand. Blood circulation is not just about your heart. It is about the entire network of arteries, veins, and tiny blood vessels that carry oxygen and nutrients to every single part of your body. Your brain, your muscles, your organs, your skin, your nerves, your feet, and your hands. When that system is working well, you feel energized. Your mind is clear, your legs feel strong, and your body heals itself efficiently. But when blood flow begins to slow down or become restricted, things start to go wrong. And for seniors over 60, this is a very real and very serious concern. As we age, our blood vessels naturally lose some of their flexibility. The arteries can become stiffer, plaque can build up along the walls of the blood vessels. The blood itself can become thicker. All of these changes make it harder for blood to travel efficiently through the body. The result is poor circulation, and it can affect your quality of life in ways you may not even realize are connected to blood flow. But here is what matters most. The warning signs almost always appear before the serious problems do, which means if you know what to look for, you have a real chance to act early. Let us go through all 7 warning signs right now. Pay close attention, because some of these may already be happening to you. Warning sign number 1. Cold hands and feet, even when it is not cold outside. This is one of the most common and most overlooked signs of poor blood circulation in seniors. When blood flow is reduced, the body naturally prioritizes keeping the vital organs warm: the heart, the lungs, the brain. As a result, the extremities, the hands, the fingers, the feet, and the toes, are the first to be cut off from adequate blood flow. If your hands feel cold even indoors, or if your feet are always cold at night even under blankets, this is your body telling you that blood is not reaching those areas the way it should. Think of it like a water pipe. If there is low pressure at the source, the water does not reach the farthest taps. The same thing happens with your blood. The solution starts with keeping your body moving. Even simple ankle circles while sitting or walking for just 10 minutes a day can help stimulate better blood flow to your extremities. But that is not the biggest sign. Stay with me. Warning sign number 2. Leg cramps and pain when walking, especially in the calves. This is something many seniors write off as just being out of shape or having tired muscles. But in reality, cramping pain in the legs during walking, and pain that gets better when you rest, can be a sign of peripheral artery disease, which is a condition where the arteries in the legs become narrowed and blood flow to the muscles is reduced. When the muscles in your legs are working but not getting enough blood, they go into a kind of protest, and that protest is pain. If you notice that you can only walk a certain distance before your calves start to cramp or burn, and that resting makes it go away, please do not ignore this. This is one of the warning signs that warrants a conversation with your doctor as soon as possible. The sooner this is caught, the more options you have. Warning sign number 3. Swelling in the legs, ankles, or feet. Have you noticed that your ankles look puffy by the end of the day? Do your socks leave deep marks in your skin? Does your foot feel tight inside your shoe in the evening, even though it fit fine in the morning? Swelling in the lower extremities, what doctors call edema, is often a sign that blood is not flowing back up from the legs efficiently. Healthy circulation includes the return journey, the veins bringing used blood back up to the heart. When this return flow is sluggish, blood and fluids start to pool in the lower legs and feet. It is like a traffic jam. Everything is stuck at the bottom and nothing is moving. Elevating your feet when you sit, doing calf raises throughout the day, and staying well hydrated can all help keep that return circulation moving. But there is another warning sign that is even more subtle than swelling, and most seniors never make the connection. Stay with me because the next sign surprises many people when they first hear it. Warning sign number 4. Slow healing wounds or sores on the feet or legs. This one is particularly important for seniors who have diabetes or who are at risk of diabetes. When blood circulation is poor, the skin and tissues in the lower legs and feet do not receive enough oxygen and nutrients to heal properly. A small cut, a blister, or a minor scratch that would normally heal in a few days can take weeks, or even months, in someone with poor circulation. And in some cases, these wounds can become infected because the immune cells that fight infection also travel through the bloodstream. If you have noticed that small wounds on your feet or lower legs are taking much longer than usual to heal, or if you are developing sores that come back repeatedly, this needs medical attention. Do not wait. Poor wound healing in the feet and legs is one of the warning signs that doctors take very seriously. Warning sign number 5. Skin color changes, especially in the legs and feet. Healthy blood flow gives the skin a natural, even tone. But when circulation is compromised, the skin can start to change in noticeable ways. You might notice a bluish or purplish tint to your toes or feet. This is called cyanosis, and it means the tissues are not getting enough oxygen. You might also notice that the skin on your lower legs looks shiny and tight, or that it has taken on a reddish-brown color, almost like a stain. Some people notice that one leg or foot looks noticeably different in color from the other. These are all visual signals that blood is pooling, restricted, or oxygen depleted in those areas. Pay attention to the color of your skin below the knee. If something does not look right, it may be because the blood flow in that area is struggling. And what I am about to share next is something that many seniors would never think to connect to their blood circulation at all. But the science is very clear on this. Warning sign number 6. Mental fog, memory lapses, or difficulty concentrating. Most people think of circulation problems as a leg and foot issue, but the brain needs blood flow more than almost any other organ in the body. The brain makes up only about 2% of body weight, but it uses around 20% of the body's blood supply at any given moment. When circulation is poor, the brain is one of the first organs to feel it. Seniors with reduced blood flow to the brain often experience difficulty focusing, moments of mental fogginess, short-term memory lapses, feeling mentally slow or sluggish, or difficulty finding the right words. These symptoms are easy to dismiss as just getting older, but they can absolutely be related to poor vascular health. If you or someone you love has been noticing more mental fog than usual, alongside any of the other signs on this list, it is worth discussing with a doctor. The brain and the heart are connected through the same circulation system, and what affects one often affects the other. Now we have reached the most important warning sign on our list, number 7. And this is the one that most seniors, and even some doctors, overlook. Are you ready? Because this one changed how I approach circulation in my patients. Warning sign number 7. Unexplained fatigue and low energy, especially in the mornings. Fatigue is the most common complaint I hear from seniors, and most people accept it as just a natural part of aging. But chronic, persistent fatigue that does not improve with rest, especially fatigue that is worse in the morning and better as the day goes on, can be one of the earliest and most telling signs of poor blood circulation. Here is why. When blood flow is reduced, the muscles, the organs, and the brain are all getting slightly less oxygen and slightly fewer nutrients than they need to function at their best. It is like trying to run a machine on 60% power instead of 100%. Everything works, but it is slower, harder, and more exhausting. Many seniors who start improving their circulation through simple daily habits, more movement, better hydration, healthier foods, report that their energy levels improve noticeably within just a few weeks. Not because they found a magic solution, but because they finally gave their body the blood flow it needed to function properly. If you have been feeling tired every day and you cannot explain why, do not just accept it. Consider that your blood flow may be the missing piece. Let me quickly recap what we covered today. We went through all 7 warning signs of poor blood flow that seniors over 60 must never ignore. Cold hands and feet, leg cramps when walking, swollen ankles and feet, slow healing wounds, skin color changes in the legs, mental fog and difficulty concentrating, and unexplained fatigue that does not go away with rest. If you are experiencing one or more of these signs, please do not brush them aside. Your body is communicating with you, and the earlier you listen, the more you can do to protect your blood vessel health, your heart, and your overall quality of life. Small changes in your daily routine, staying active, drinking more water, eating foods that support artery health, and managing stress can make a real difference over time. If this video was helpful to you today, please give it a like and subscribe to Dr. Sarah Mitchell Healthy Tips so you never miss a new senior health video. We post new content every week covering blood flow, circulation, heart health, and everything seniors need to stay healthy and feel their best. And if you know someone over 60 who has been experiencing any of these warning signs, please share this video with them. You could help them catch something important before it becomes a bigger problem. Thank you so much for watching, and I will see you in the next one.